Genital herpes or HPV, human papilloma virus, is one of the most widely spread sexually transmitted diseases. This disease is caused by herpes simplex virus type 1, HSV1, or type 2, HSV2. According to a national representative study on sexually transmitted diseases, 1 out of 5 adolescents and adults have had herpes in the United States. It is also more common in women, perhaps because male-to-female transmission is more prevalent. Like most sexually transmitted diseases or STDs, herpes only has minimal symptoms such as blisters on or around the genitals or rectum. These blisters would eventually break and leave sores that would last for 2 to 4 weeks. The first outbreak is usually the worst, and it will gradually become less severe after a few weeks or months. Herpes has no visible symptoms, but its virus are released from the sores which normally infects the mouth and lips caused by oral-genital or genital-genital contact. When diagnosed with herpes, one has to treat the signs first and avoid sexual contact because the infection could stay in the body indefinitely and can be transmitted unknowingly. Herpes is transmitted through skin-to-skin contact and its symptoms can occur within 2 to 20 days. Since these signs are mild or hardly visible, they can be easily mistaken as mere sores or vaginal infection among women. If you experience at least 2 of the following, it is better to consult a doctor immediately. 1. Red and sensitive skin. 2. Sores or blisters in and around the genital area. In women, these blisters can develop inside the vagina. 3. Vaginal and penis discharge. 4. Burning sensation when urinating caused by infection of the urethra. 5. Headaches and flu-like symptoms. 6. Muscle aches, specifically lower back pain. 7. Fever brought about by the infection in the body. If you are experiencing itching, tingling, numbness, general fatigue and pain in the buttocks and lower back, these might be symptoms of herpes. Before the outbreak, skin becomes tender and reddish, making it more sensitive and prone to itching. Blisters or tiny red bumps can eventually occur and might look like small fissures or fluid-filled lesions. During its outbreak, these blisters will become ulcers, and when the blister skin breaks, out comes a milky fluid liquid. When the sores turn into scabs, this is the start of the healing process, but the infection might still be present and retreat to the nerves. You have to wait until a new skin is formed. People with poor immune system is very susceptible to this disease as well, and herpes infection can become severe. Pregnant women who were not aware that they have contracted herpes can put their babies at a very high risk. Thus, a cesarean delivery is usually performed to pregnant women who are infected with herpes. Herpes can also help spread the HIV virus, which causes AIDS, by making infected people more susceptible. That is why, upon the first few signs of herpes, you have to seek professional help and avoid sexual contact until the infection is taken care of. There are reliable treatment methods for genital herpes. You won't have to be embarrassed at all. For more information how to treat genital herpes, visit the link in description.